Hi ladies, welcome to the Joy for Midlife program. If you're new to this program, I'm Cheryl Jones, your host. I invite you to hit subscribe on the Community Voice channel tab so that you will be notified of my new programs, but also notified of all the wonderful programs that are sponsored by the Community Voice channel. Today, we'll talk about breast cancer awareness, early detection, health services, and events around the community in Connecticut. This program is dedicated to everyone who has been affected by this disease. You know, every year in October is the month of breast cancer awareness events, but every day is an opportunity to be aware, to learn about prevention, early detection, and to be supportive. My guest today, and I have three guests with me, is Peaches Johnson-Hales. Peaches is a survivor, and she now works passionately as one of the coordinators for the annual breast cancer walk that's held in Vernon, Connecticut. Two other guests, Georgann Torres, she's a community health navigator, and Edry health systems navigator. Hi ladies.
Hi.
Hi. Thank you for joining me today.
Thank you.
So let's get started. Edry, would you give us some information? You're a health service navigator. Give us some information regarding breast cancer awareness, health services, early detection. What can you tell us?
The Early Detection Prevention Program is a fantastic program for women in Connecticut, all through Connecticut, who have or have had a breast or a cervix. The primary objective of the program is to significantly increase the number of residents who receive breast and cervical cancer screening, diagnostic screening, and treatment referral services, along with reducing residents' risk of heart disease and promoting a healthy lifestyle through the Wise Woman portion of the program, which Georgann does. For those who qualify, all services we offer are free of charge. To qualify for the breast and cervical cancer screening, you must meet income guidelines of at or below 250% of the federal poverty level, be uninsured, underinsured, or have an insurance deductible of $1,000 or more, be between the ages of 21 and 64, and for those over the age of 64, if you're not covered by Medicare Part B, you also qualify. And for the Wise Woman portion of the program, you must be between the ages of 35 and 64.
Thank you. Thank you for covering that portion about if you're beyond the age 64, how to handle the need for services. That's great to know. Is there anything, give us a little bit more detail about the services that you actually provide or how a woman would be contacting you for services, what steps they need to take?
So they can give us a call and we'll provide you with the phone numbers, email. You give us a call, you'll get me, and I will ask you some questions. Basically, what is your household income before taxes, and how many people does that income support? That's the money guideline portion of it. Then I'll ask you, do you have insurance? If you do, what is your deductible? And if you don't, again, and these two things are what qualifies you for the program. Simple as that. It's just a phone call, a 5-minute discussion or less in order to qualify you. Then I'll register you for the program and we'll set you up for an office visit, which includes a clinical breast exam, Pap test, and HPV screening if you're due, otherwise just a pelvic exam, and we'll figure that out if you're due or not. We will get you scheduled for your screening mammogram if you are 40 and above. If you are 35 and above, then Georgann will also go over the heart health risk reduction program, which includes typically a finger stick to check for your cholesterol and glucose for diabetes, your blood pressure, your BMI, other things like that, and discuss the heart part of it. Also covered, if necessary, are diagnostic mammograms. Say you're having an issue or they want you to come back for additional screening. That's covered. Breast ultrasounds, breast biopsies, fine needle aspirations, colposcopies, loop electrode excisions called LEAP exams, and surgical consultations, all again free of charge.
Wow. This sounds like a very comprehensive testing, screening for women, and to know about, you don't have to be concerned about the dollars, about co-payments, about payments afterwards, you know.
Correct,
that might
correct.
come your way that you weren't aware of. Now, these services are provided throughout Connecticut. Okay.
They're provided basically through most Connecticut hospitals. So we
Okay.
are part of ECHN, which includes Manchester Hospital and Rockville Hospital.
Okay.
So we provide these services that I just discussed in Manchester, and the office visits in Manchester and Vernon. And then the imaging would be Manchester, Vernon, Tolland, or South Windsor. And very shortly, we'll be partnered with Planned Parenthood in Enfield, Manchester, Waterbury, and New Haven.
That's excellent. So you're reaching women in all different aspects.
Yes.
You know, Planned Parenthood and through just women's care, health care. That's wonderful.
Yes.
Now, did I hear you say that you make visits to programs or events during the month of October?
Oh yes, through October and throughout the year, we will go to, community events, and we'll set up a table with our information.
Okay.
If requested, we'll come in and do to businesses or other community places to stand and speak about the program, give out information. Yep, and we will go anywhere anybody asks us to, and whenever we're able to do tables, like at the West Hartford Bloomfield Health Fair, the West Hartford Juneteenth event,
Okay.
Vernon's July in the Sky.
Right.
Yep, lots of events
So
like that.
really no reason not to be aware of the health services that are available for women in Connecticut. And this sounds like an invitation where Edry will come. She'll come to your location, to your event, and share this information. So that's wonderful. So Georgann, we want to hear about the Wise Women program. I've been involved in a couple of conversations and workshops for the Wise Women program, and it really is a wonderful reach.
Yes.
Tell us about what you do.
So I'm the community health navigator for the early detection program, and the early detection program is a grant funded program through the Department of Public Health. And our mission is basically to provide services for women that has heart health disease or at risk.
Okay.
And what we do is we offer them with, blood pressure checkups, cholesterol, glucose. Also, we have a diabetes prevention program.
Okay.
So that we can refer them over if need be once their results are in. We also offer resources in the community, so they don't only come in for the appointment and that's it with us. No, we offer resources in the community if need be, referrals in the community. We work closely in the community with some of the churches in our area, Peaches being one of them included.
Oh, nice.
And at this point in Connecticut, 6,681 residents passed away since 2021 alone.
Wow. Heart disease?
Yes. So in our state, it's not only in our state, it's very important for women to take care of themselves. Sometimes they don't have the proper resources and whatnot. And our program, like Edry explained, has all of the needs for somebody that don't have insurance and need the care.
Yes.
We can offer them that.
Okay. So how does a woman that might be wanting to, have her heart checked or, have that service provided to her, how does she reach you?
Through our contact information, they'll get
Okay.
Edry. I do
Okay.
most of the outreach out in the community.
Okay.
But if they need to speak with me, they can go through Edry at first.
Okay.
Any questions, any scheduling of the appointments and whatnot, that would be Edry. But if I need to be reached, there's the number would be on the screen.
Yes.
I am also bilingual. I speak Spanish, so
Excellent.
yes, we try to accommodate not only the Spanish-speaking community, but also we've had patients. We have a translator line, and we've had patients
Okay.
from, many different languages. So,
Okay.
yes.
So do you feel this program is making, a notice around the Connecticut communities? Is it something that we need to keep communicating? Of course,
Yes.
that's what I'm trying to do.
Yes.
But, yeah.
So yeah, like as you mentioned earlier, we are becoming partners with Planned Parenthood to also
Okay.
have more reach and have more women benefit from the program. So yes.
Okay. And then something just occurred to me. Do you have to be without insurance totally to be receive these services?
No.
Okay. You could be underinsured or?
Yes,
Yeah.
underinsured or with a deductible of $1,000 or over.
Oh, okay,
Yes.
yeah, like high deductible?
Yes, high deductibles.
Yeah, okay, that's good to know. Oh, thank you so very much for that,
welcome.
Georgann.
Thank you.
So we also have with us, we have Peaches with us, and we want to hear from her, so don't go away.
Every 14 seconds, somewhere in the world, a woman is diagnosed with breast cancer.
1 in 8 American women
Will be diagnosed in their lifetime.
and more than 44,000 lives are lost each year.
Breast cancer can affect your mom,
Your sister,
your grandmother,
your friend, or you.
or me. But a breast cancer diagnosis
Doesn't have to mean the end of your life.
breakthroughs to prevent and cure breast cancer
Are within our grasp.
Thanks to research, early detection,
And advances in care,
More and more women are thriving.
and finding a new beginning.
let's keep advancing.
Get your mammogram today.
get your mammogram today.
Get your mammogram today.
Get your mammogram today.
Join Lifetime.
In supporting the Breast Cancer Research Foundation.
And stop breast cancer for life.
Would you share with us a little bit about your journey with breast cancer?
Well, my name is Peaches Johnson Hales, and I remember in 2016 when I went in for my mammogram. As usual, I'm always sitting there waiting for a while after, because I always had to do like a scan of my breast after the mammogram. And I remember the doctors calling me into their office, and they told me that we saw some stuff, and we think it may be cancer, and so we want to do additional screening. And so they're like, we'd like to do a biopsy. However, they did tell me that they've been watching me for like 3 to 4 years, which is good. I was really
Very
appreciative
good.
of that,
Yes.
they actually was keeping on top of it.
Okay.
And so I opted into it, and I did a biopsy, and they came back, and they told me it was DCIS, which is ductal carcinoma in situ, which is like the beginning stage of the breast cancer developing in your duct, your breast duct.
Okay.
So I was one of the lucky ones.
Okay, very good. And so, what support did you find as you had to go through the next stages or steps that the doctors would lead you through? Did you find any support, or how did that work out for
Well,
you?
I always had support of my family, and when I did visit the Helen and Harry Gray Cancer Center, I had people there that supported me, and they walked me through, the next step that I needed to take, which I opted into, and which was taking the tissue out.
Okay.
And so I decided to, which was a lot, and so they took practically about half to 3/4 of tissues out of my breast. And so they did offer me radiation, which I opted out of.
Okay.
Because this is what they told me. If I had a radiation for the first time and the cancer comes back, then I cannot have radiation again.
It's good information.
Right, and so I opted out of it because of how it was a beginning stage, and that is why breast cancer screening is very, very important.
Very important, and you're really making that case very well, because the sooner it's caught,
Yes.
early detection,
Yes.
the more opportunity
Yes.
for care, right?
Yes,
That's very
definitely.
good to know. And to hear that support from family and friends, helps you get through the process. But you seem to be very strong too,
But-
that you knew the right things to do.
Yes, but I must tell you, Cheryl, that it's not a good news
No,
to
it's
receive.
not.
Because to a lot of people, it's a death sentence. When you hear cancer, I'm going to die.
Yeah.
And what I want people to realize, don't look at it as a death sentence. Look at it as an opportunity to go through your process and help to educate somebody else.
The way you accept this information really matters, right?
Yeah.
And you know what? I heard, speaking to someone else that is a survivor, she said hope is the difference between cancer and something else, And she said to maintain that hope, In other words, keeping a positive mindset, and that's exactly what you're saying. That's wonderful, Peaches. What was your biggest challenge, if there was one that you can think of, during your treatment into your survivorship?
I think it's more like myself, like what am I going to look like? And, you know, and this is funny, and I'm not ashamed to tell people I would like I have half a titty, you know, like it's kind of like a kind of a self-image thing. So like, what am I going to look like after? But then there are many different things that you can do. You know, I've never had mastectomy, but, you know, I've had a smaller breast than the other. Right. But there's many different things you can do to support of a bra, and, you know, different prostheses that you can use, and also surgery. Right. So, you know, if you're like me that likes to look good, you can opt into surgery and get, you know, breast augmentation.
Yeah. And so all women want to look beautiful, right? Yes. We're all concerned about, whether we want to admit it or not, we're all concerned about our appearance. And outside of having a health issue, we're concerned about our appearance and such. And so, yeah, that's important to know that there's a lot of support that way. Yes. Cosmetology out there that way for us to help us. And appreciate that. And we just have to seek it out. But we just say it's not an easy process, understandably, not an easy process. And I'm overwhelmed when I hear that someone is a survivor and all the things that they had to go through, because I know it's tough just from living, you know. And but I feel really so appreciative that you're here sitting to talk to us, because you're really helping another woman out there, or someone that knows a woman you're helping, you know. Yes. So tell me about this. When did you decide to join Breast Cancer Awareness Walk Foundation? Okay, so when we started, because I'm a part of the Voice of Triumph Apostolic Ministries, and so when we started back in 2019, going into 2020, you know, I'm passionate about it because I had a aunt who also had breast cancer. Okay. Unfortunately, she had 10 years in remission and eventually died. Okay. And but my girlfriend, one of our coordinators, Michelle Walters, her family also had cancer issues, and you know, we wanted to find a way to give back to our community. Like, what can VOTAM do for the community, you know? And so we approached our pastor, Pastor Jerome Ald, and we said, you know, we'd like to start doing something different and bring awareness to breast cancer. And he was like, yeah, that's a good thing, and that's how we started. Oh, and how long has that been? So since 2020, so this is our 5th walk. Okay. This year, October 12th, will be our 5th walk. That's beautiful. Yes. That's what, and I was not able, I think the rain scared me away last year, I'm not sure, but I know the walk still happened, and I'm really hoping to be a part of that this year. So tell us the date, the place, where is this occurring? Okay, so this is going to be at, we're starting out at 401 Hartford Turnpike. Okay. And this is over by the VOMC Church, which we also partner with, because we are Voice of Triumph Apostolic Ministries out of that church. And so we're starting there. They were going to the Hop River Trail in Vernon. So it's the park, which is down the road. So we do have people standing by that will say, okay, this is your direction. So we have, you know, guiders, and if you needed to cross the road, we also have that as well. So it's usually, once we get to the trail, it's like we call it a 3-mile walk. I'm not sure, you know, if it's accurate, but somewhere around in our minds, it's a 3-mile walk. Probably feels like it too, definitely. If it's like 2.5, it's still feels like it, I'm sure. And so this is going to be on October 12th, and we start our program at 9 a.m. and we end at 12 p.m. Okay, and we should have that up on the screen for everyone to take note of that. We hope that some of our viewers would be interested in joining an event during the month of October to show your support. But we also know this is for fundraising, correct? As well, definitely, definitely. Okay. So we're in collaboration with Georgann from the Rockville Hospital, ECHN, and also Kristen from Hartford Healthcare Cancer Institute. And we've donated quite a bit because we've had our community that came in and helped us. And so last year we gave Hartford Hospital a check for $2,800. Oh, that's wonderful. Yep, $2,800. And so we're trying to beat that this year. Yeah. And Georgann, you know how their situation is set up. So we normally give them bags of love, which is a staple from our church. Okay. So this started out during
when we had COVID. And so we'd give these are the bags to, the first responders. And so we're like, okay, what can we do for Breast Cancer Walk? And so because Georgann Hospital, they don't really take the cash, but they take the other things. So we would pack these bags with socks and different items that a person going through or a survivor may have. And so this we give to them. We also gave them bags last year, I think about 60 bags last year, and that is how we get our voice into the community.
And so those bags go out to women that are in treatment for some, is that it?
Well, we distribute them through our wellness events. So at the tables, we offer them to clients of food pantries, clients of other churches, anyone in need, and they're wonderful. They can have a mix of things like hand sanitizer, warm fuzzy socks, lip gloss, face masks for especially during COVID, extra face masks, all sorts of little goodies and swag, as we like to call it. And then we usually throw in some of ours as well, chip clips and refrigerator magnets and jar openers and just handy little things to, make the day a little easier.
Very nice, very nice. Okay. So let me ask you, Peach, is there any words of wisdom for someone experiencing the path of cancer recovery? Because we know men and women are exposed to this disease.
Right. If I should leave a word, it would be never give up the fight. Because you cannot give up. It is not the end of the road. It is not like you're going to die tomorrow. I mean, some people everybody's experience is different.
Sure.
But, just have the thought that I'm never going to give up. And God, one of my biggest I think support was just having that spiritual peace.
Yes.
So if they're able to find that spiritual peace, that will be definitely a plus.
Right. Thank you.
Keep fighting, never give up.
Thank you. Yes, we know that spiritual peace or connecting with someone that has a spiritual background that can help lead you through that. Reach out for support. That's what I'm hearing. Very good. And I thank you, ladies, all of you, because you're showing that there's services, health services, there's mindset support, and just friendship support. That's what we're talking about today when you're experiencing this disease. So Peaches, what else? Do you have anything else that you wanted to say? Or?
Well, yes. So please come out on October 12th, and we're going to be having a lot of activities. We have raffles, prizes, DJ by Busy Radio. The Red Cross Blood Drive also will be there. This is something new that we're doing this year. Last year we didn't have it. And a chance to meet Miss Vernon, Connecticut. That's always a plus. Everybody wants to meet Miss Vernon, Connecticut. So we have lots of different ways you can register on Eventbrite. We're also going to be putting on our screen ways that you can be a part of this and the way that you can donate as well. We want to make sure that this gets out to everyone because cancer is not prejudice. No. It is definitely not prejudice. It hits whomever it will. And so we want to make sure this gets out. But before I go, I want to say thank you to just a few people, if I can.
Sure.
I want to thank Pastor Hall, First Lady Hall, Sister Michelle Walters, and God bless her today. She's doing brain surgery. She should have been here, but she just came out of a brain surgery. Thank God she's okay, and she's recuperating. We want to thank Terry Rogers, a Vernon Councilwoman. She's been a part of us. Busy Radio, Georgann from Rockville, Kristen from Hartford Hospital. We have people that donate quite a bit of money into this. Brass Plating, Brighton Early Daycare in Hartford. We have McDonald's, Tonkleville Road, Dunkin' Donuts, Tonkleville Road, Dunkin' Donuts, Hartford Turnpike, Stop and Shop. I'm almost done. South Windsor, Price Chopper in Windsor, Trader Joe's Manchester and West Hartford, Panera Bread in Evergreen Walk, ShopRite in Manchester. We thank you so much, and we're looking forward for more community involvement. I'll be knocking on your doors. Please don't send me away. We need you. You need us.
That's wonderful. I just have to say to Peaches, because you know what? She is a co-coordinator of the event, but she is a hard worker. She really is, and she's giving back to women. This is about women helping women, and Peaches is definitely a prime example of what you can do and what is being done. And we really we know that there's a lot of events going out around the Connecticut Valley in the month of October, but this is one of the events, and we really like to know if you'd like to join. The information's on the screen if you want to look into it. And thank you to all the companies and the businesses that and the persons that she's mentioned that are supportive, because it takes a village, right? It takes a village. So that's wonderful. I do want to share another event that was brought to my attention that's coming up in the month of October, and it's co-sponsored by the Connecticut Department of Health and a business called JHR Breast Cancer Foundation. And it's very interesting because JHR stands for Joy's Hair Repair. She's a salon owner, and she is a survivor, and she has developed Breast Cancer Foundation, and she's giving her 3rd anniversary foundation banquet on October 5th. So that information is going to be available to you on the screen as well. Perhaps you're interested in getting dressed up and going out to celebrate and support at the same time, because it's a fundraiser, and hear a good word, some more information, breast cancer awareness information. That's another opportunity. So that's what we want to do. We wanted to just make you aware of health, heart health, breast cancer awareness health. There is support for you. So I thank you for listening, and I thank you ladies for coming in so much. Is there anything else that you'd like to share with us?
I just want to remind women to take care of yourselves. I know we're always busy taking care of everyone else, and we put ourselves last, but we really need to take care of ourselves to be able to take care of others. Remember to do your monthly breast exam, self-breast exam. Typically speaking, most lumps and bumps are found by ourselves before they're found by screening. We know ourselves best. And don't be afraid to reach out if you have any questions, whether you qualify for the program, whether you're confused about what to do. Give me a call. I'm willing to try and get an answer for you, regardless of what that question may be. Just give me a call.
Thank you, Edry.
Our contact information will be up on the screen. So like Edry said, any questions you may know of anyone, you're not sure, if you qualify, please just reach out. Thank you for having us.
And that's a wonderful title for the services that you have, Wise Women Program, because we want to stay wise about our health. Yes. So ladies, if you want a little more joy after this Joy for Midlife Women, I want to remind you that there is the Joy magazine. It's available by subscription, so you can go to the website, www.thejoymagazine.com. It has more information and inspiration for you. So until next month, I wish you to stay joyful. Have a good day.